Hey, there's the light.
All right. Good evening, everybody. It is Monday, December 16th. We're in the Aldermanic Chamber. This is the Human Affairs Committee, and it is 7 p.m. Mr. Clark, would you like to call the roll?
Sure. Alderman Chris Thibodeau. Here. Alderman Tim Sennett is here. Alderwoman at Large Gloria Timmons. Alderwoman at Large Shoshana Kelly, Vice Chair.
I'm here.
And Alderman Tom Lopez, Chair.
I am present.
We're also joined by Alderman Klee and Director Bobby Bagley. Wow, I can speak tonight. And Henry Auck, President and CEO of HarborCare.
All right. Do we have anybody signed up for public comment? It doesn't look like there's anybody here. Seeing none, I'm going to start with the presentation from HarborCare. Henry, if you'd like to come up and just grab a seat, you can pick anyone you want. Mine's obviously empty.
Except for one that somebody's sitting in.
Yes, that would be awkward.
We are silly tonight.
You are a little
So
silly
just for our
tonight.
transcriber, if you could introduce yourself initially with your name and your address, and then when you're speaking, just say Henry Hope. Just because they may not be as familiar with your voice, so if they're listening, it helps them write.
Okay, thank you for having me. My name's Henry Oach, employed at HarborCare, located at 77 Northeastern Boulevard in Nashua, New Hampshire.
Okay. Do you want to introduce the different programs that you do and kind of get us started?
Sure, absolutely. So HarborCare is an agency that was established in Nashua 40 years ago. And we are an agency working on breaking the cycle of homelessness. And we do that through providing housing and housing supports, providing health care, specifically health care for individuals experiencing homelessness or at risk of homelessness, and through a wide array of services for homeless military veterans. Now, within each of those areas, we have many programs, which I'm happy to talk about in detail.
So, yeah, you just introduced like a number of different categories there's a number of residential buildings, there's a number of outreach. Any particular ones you want to start with? I know we had invited you to talk about Delanus because I wanted to kind of have some conversation about a low barrier shelter model and what that might look like. But you're welcome to kind of give an overview or highlight any programs you want.
Okay, well, let's start off with housing, as that really is that's the roots of the organization. So within our housing programs, we have many properties across the state of New Hampshire. Most of them are clustered in and around the greater Nashua area. Through our housing program, we provide housing and housing supports to over 1,000 households across the state of New Hampshire. Within our healthcare space, we provide services to approximately 3,000 patients annually through primary care, behavioral health, addiction treatment, and dental services. We have a 65-bed licensed addiction treatment facility here in Nashua, located on Amherst Street, where we provide addiction treatment to pregnant and parenting women. And those women can stay in our facility for up to a year. And within our veteran services programs, we provide transitional housing, of which the Delanus House, which you mentioned, is part of. We have 2 transitional housing facilities here in Nashua and 1 in Manchester. We have a permanent housing facility providing housing to 30 previously homeless households in Plymouth, New Hampshire. And we also have a statewide suicide prevention program in collaboration with the VA, job assistance for previously homeless veterans. And we also do a lot of prevention work because we really want to address the issue of homelessness before it happens. Overall, we provide services to 450 military veterans annually across the state.
Now, not to derail the conversation about veterans, but something that jumped out was when you were talking about addiction, substance abuse recovery services. The program at the moment is operating with a focus on women from Cynthia Day.
Yes.
Is the Keystone model, has that changed from its historic purpose, or is it under renovation, expansion, redevelopment?
So a couple of years ago, we began a project to renovate our clinic at the facility located at 615 Amherst Street. That resulted in us taking 25 beds offline, which were historically for male and female clients. So those beds were offline for a couple of years. We just finished the construction project, and the clinic will be opened the second week in January of next year. We did make the strategic decision to shift our focus to pregnant and parenting women for the entire facility at this time. However, we have recently launched a program called the High Intensity Outpatient Program, which provides 20 hours of individual and group treatment located at our 45 High Street location. And to support that program, we have launched a couple of recovery homes here in Nashua, and those homes are specifically for male clients.
So the work that Keystone initially was doing is still being done, but at this point it's in a more diffused model, and the changes were largely just to recognize that evidently there was a increase in single mothers and even pregnant mothers that were struggling with addiction?
So there are only 2 programs in the state of New Hampshire that provide support to pregnant and parenting women. Harbor Care operates one, Hope in Haven Hill is the other one, but their capacity is significantly lower than.
Is the utilization of that, you find a lot of New Hampshire parents doing it, or would you say it's more of a regional thing?
So at this point, the second floor of the facility, which is the one that had remained open, has had a very high occupancy rate. So we definitely see a demand for services. So once those beds come back online early next year, we should have a good number of people through the program.
Okay. Before we continue about the Veterans Program, did anyone have any questions about Cynthia Day? Cleve?
These aren't veterans, these are just women in general.
That's right.
That are being.
Yes.
May I ask a question? WMUR today on the news spoke about homelessness and said that New Hampshire was the #1 homeless capital right now in the country. They also said that our veteran population homelessness was actually dropping.
Mm-hmm.
Comparatively speaking. Are you seeing that within your program? Are you seeing those numbers dropping, or do you think that because of the programs that you're doing, and I know you're going to talk about it, so I don't want to steal your thunder in any way,
Mm-hmm.
but are you seeing some of the work that you're doing kind of helping in that? And again, I don't want to steal your thunder, so.
Yes. Okay. So the conditions here in New Hampshire. Looking at the situation from state to state, each state has its own nuances. I think it's clear that here in the state of New Hampshire, we have an extremely low occupancy rate across many communities, and that has an impact on the state of homelessness. But to speak about the veteran population specifically, as of December 6th, there were a total of 141 identified homeless veterans across the state. Now, that number has been fluctuating in and around that area for the past 6 months. Now, we have recently made some pretty good progress in a couple of communities, Manchester and Concord, and we've had an active initiative here in Nashua for many years. Specifically in the city of Manchester, we're working with the Mayor Rue, to set forth a plan to effectively end veteran homelessness in the city. When we launched the initiative on September 20th, we had a total of 47 homeless veterans in the city of Manchester, a combination of individuals that were living in shelters, transitional housing, or completely unsheltered. Since Since that initiative was announced on the 20th, we have been able to permanently house 16 veterans within that city, which is really a phenomenal effort led by the mayor and a number of community agencies, to include Harbor Care. Within the city of Concord, we have a smaller number. The number there is 11, but similar effort. We have a coalition working on the issue, and we have found that is really a best practice. That's actually how we were able to effectively end veteran homelessness here in Nashua many years ago, by bringing a number of stakeholders to the table, led by the mayor, with support from the state. And we're going to continue to utilize that approach to address the issue of military veteran homelessness. And what's important to note is that the lessons learned from that initiative can be applied to then focus on other populations within the broader homeless population in any given community.
Thank you. Thank you, Mr. Chairman.
Alderman Clee, if I could just ask for clarification, did they say that New Hampshire had the largest homeless population, or maybe the largest increase?
No, they actually, if I'm not mistaken, when WMUR, I watched it just prior to coming here. I was quite
just
stunned at it.
recollection, yeah.
They actually said that we had the way that they referenced it, the largest, but I have a feeling that they probably meant per capita.
Yeah, 'cause
Is the way they
New Hampshire's
reference it.
population is equal to Philadelphia.
Or
it's
San
like-
Francisco or something like
Wow.
that. I would think it would probably be per capita.
Yeah,
They reference it as the largest homeless population, but I have a feeling they meant per capita.
And I know there has been a lot of discussion of increase, and I know Director Bagley can probably speak to this.
Yeah.
But a lot of the issues with increase, there have definitely been a lot of people who've struggled with, loss of housing over the past year, but the numerical increase can also, a contributing factor is better documentation and outreach than we've had in a while.
Right.
Because if you're counting people that were never counted because they were too far out or moving around or organizations weren't collaborating, then your total number doesn't look as big as it really is. But we've seen, not just here in Nashua, although I think we lead, but in other communities, a concentrated effort to try to collaborate and coordinate services that I haven't seen in years. So I would say the last 2 or 3 years, we've really seen people getting out and doing that. But that's just my opinion. I just want to.
I have a feeling you're absolutely correct. It was the news at 5 that I was watching, and I made it go back and listened, and that I was quite shocked at.
Yeah, I'm going to check that, because
yeah.
we're the second biggest city in New Hampshire.
Yeah.
Like, what? Alderman Clee? Alderman Thibodeau, you didn't have your hand up, right?
Kelly, I had my hand up.
Okay, but I'm just making sure that this side of the room is getting, okay.
Nope, I'm good.
Alderman Kelly?
Interestingly enough, I just had a board meeting where we talked about this, and I pulled it up because I remember that specifically. And so what I have in front of me is that the homeless population in the United States from 2020 to 2023 went up 11%. In New Hampshire, it went up 31%.
Yeah.
In Nashua, it went up 14%. Really interesting to look at too when you look at like the median household income for United States is $77,719, but Nashua's $97,667, and our poverty rate is 7.6%. It's a lot of interesting data. I'm happy to share it with you, but it's.
And I apologize for speaking out of turn. I do want to clarify, now that you've mentioned it, they did say that our increase, it was an increase. They said that our increase doubled. That's what
Okay,
it was.
and-
Our
and-
increase doubled, and so,
And I didn't want to
yes.
put you on the spot,
Yes,
but that
no,
number
right.
surprised me.
Thank you. It was. I did
A
miss.
percentage
I did
increase doesn't
misspeak.
surprise
Yes,
me.
I did
A percentage
misspeak.
increase is a function of a
Right,
population.
right.
So where you have a smaller population, if 5 more people are
Right.
homeless, then it's actually statistically relevant.
But it's not Nashua, it was New Hampshire. It was New Hampshire, not Nashua,
was
it was
New
New Hampshire.
And the frustrating part is, even though our shelter beds are up 50%, and this is specifically emergency shelters, I mean, we're not keeping pace, because we're not even meeting the need that was there, and now we're trying to meet the need that is now 30% bigger.
And it
So
was from
this
23 to
is,
24.
this state of being is partly what inspired me to bring Mr. Och in, because we've been talking, and Director Bagley, I don't know, maybe I should have invited you up to be here as well, but Director Bagley and the Health Department had presented on a low barrier housing possibility, And it struck me that Delanus is very similar to that model at this point, where people come in, period, and you figure out what their health needs, what their mental health needs are, what their economic needs and all that. And then you work with them to start stabilizing their housing through different phases until you're able to establish either permanent supportive housing or, you know, they're making their money and they're back on their feet. Director Bagley, was there anything you wanted to comment on that we've said already before I have
Sure, just, even just to add to the conversation, and based on that percentage increase, it was based on a point-in-time count that's done nationally, and the data points that were shared do show the increase. The New Hampshire Coalition to End Homelessness said that it reported that there was we had a 52% increase in the number of people experiencing homelessness in our state, but then that was just based on that point-in-time count for 2023 last year. In 2023. And then the national average, as is mentioned, is up to 12%. And we will be doing another point-in-time count in January so that we can, again, contribute to that data collection. And we've seen an increase in the number of individuals that are experiencing homelessness across the state and in different towns and different cities. And so we know that this is a real problem that we have. But our homelessness is really based on our housing crisis that we have. And so the programs like the Delanus House and the model that Mr. Ochi talked about are really important. And if we could replicate some of those models, then we could do that with specific populations based on what their primary issues are that they're facing.
Mr. Ochi, if you want to give us a general idea of Delanus history, who is this Mr. Delanus? It's Robert Delanus, I believe, and then also what the general experience and layout is?
Sure. The facility was named after Griffin Delanus, who was a prominent veteran advocate. And actually, the other facility located here in Nashua, Buckingham Place, was named after Byron Buckingham, another prominent veteran advocate. So the transitional housing program that Harbor Care operates, again, we have 3 facilities, 2 in Nashua, 1 in Manchester, are intended to bring a veteran in and set them up with the resources and the tools for them to eventually move on to independent living and permanent housing, and in many cases, permanent supportive housing. When a veteran is identified and deemed appropriate for eligible and appropriate for transitional housing, they meet with a caseworker who, in collaboration with the VA, puts together a service plan, and that service plan can include gaining access to primary care, behavioral health, or other services. If they are willing and able to work, they'll work with one of our service providers to get connected to employment. The program is designed to have a veteran live in the facility for up to 2 years. On average, however, we found that we're able to place veterans into permanent housing within 1 year. Now, specifically within the Delanus House, that facility has a total of 40 beds. 32 of the beds operate in a SRO, or a single room occupancy model, with some shared living spaces. We do have 8 one-bedroom units in the facility, some of which we've converted to permanent housing for a handful of veterans. So it was established in 2010, and shortly thereafter, right before Delanus, we actually opened Buckingham Place here in Nashua. That was in 2008, and that was the first facility in the United States to provide transitional housing for both men and women. Delanus House currently is limited to men only, and our facility in Manchester is for men and women.
So for myself, I had some prehistory with Delanus. Before I even worked briefly at Harbor Homes as well. But before I was alderman, probably like 20 years ago, I was working on my licensed supervision hours for my mental health counseling degree, and so I interned at Delanus, and I got to see inside the program how it worked, the kind of ways that communities work, the way that people came together. As alderman, I know a lot of the guys that are in the permanent program because I see them every day on the street, and they're very familiar to the downtown scene. So people who are viewing this might be having the sense that like Delanus House is some sort of like receptacle for outsiders or something, but they're not. The veterans, when they connect with their community, they become part of the fabric of our community, and a lot of them are very involved in things that are happening downtown for the time that they're in Delanus, because maybe they're on their way to some other place, their own housing program. I know a couple of them actually, I think, got mobile homes in Concord. Not a small number of them live in the same building that I live in. So they stay, and I think that's a positive for the city, because I mean, a lot of them are really great people, and a lot of them just hit some hard times. But I think many people would agree that if you take a population and you start it with the premise that the members of that population have all stepped up to serve our country, you're going to have a good likelihood of some people that can really contribute to a community.
Yeah, I agree. One of the trends that we have been seeing lately is older veterans coming into the system, and that presents some challenges. And their path to homelessness, we have seen oftentimes they're living on fixed incomes, and they get priced out of their apartments. Landlords increase the rental amounts, and their fixed income just can't keep up. So we have seen that, and with that aging population, as we're trying to find permanent housing for them, it's become increasingly difficult to find units that are handicap accessible and first floor units. So those are the ones that are, for us anyway, in highest demand.
Question for Alderman Klee, only because you would know of all of us. I know we have veterans tax exemptions for veterans who own property. Do we have any for property owners who rent to veterans?
No,
Worth thinking about, I guess.
no.
Alderman Thibodeau, do you have any opinions or things you want to share?
No, I'm just taking it all in.
It's a lot of information. And like I said, I appreciate you coming in, Mr. Oates, just because it's for me, Ward 4 Alderman, the programs that Harbor Care runs are very important, especially the veteran ones. And I have a stronger affiliation, I think, with the things that go on at Delanus House, only because I have interned in that building more. But I know Buckingham does a lot of great work too. I know that there's a lot of families there that rely on it, and I think it's important for people to know the full scope of our community, especially if someone may be watching this for whatever political purposes, or if they're really, really bored and can't fall asleep. Finding out how to connect with these programs, I think, is important. So is the access point for Delanus, is that just through the regular coordinated access line? Or is there
So
another way?
what we let people know is that the easiest way to get in contact with us is right through our website, harborcarenh.org. There's a couple of ways that you can contact us. There's a phone number and a button that says "I need help," and you click on that. We'll get. There's a team that responds to that, and ultimately we'll reach out.
Okay. Alderman Klee?
Thank you. Do you also coordinate, like, with the Department of Veterans Affairs? I worked with the Department of Veterans Affairs for a lot of years. I came up through their system. So do you work with the Manchester VA? Do you work with their program? I heard that one of the homes and so on, I heard that you said that you were affiliated with them through that program. And so do you coordinate with them? I know they have obviously they have their coordinators as well in Manchester and so on. So do you get referrals from them? When people come to you, do you work with them? Because especially here when you were talking about how coming into the system and they're getting priced out of their apartments and so on, I assume that are these veteran service connected? Are they getting benefits? Are they just?
Some of them are. Some of them
are just not necessarily service connected, just kind of.
Right. In some cases, they some veterans might not necessarily know the benefits that are available to them. I'll give you an example. But to answer your question directly about the VA, yes, we work with them very, very closely. We have VA licensed social workers at our facilities almost every day. And at our permanent housing facility in Plymouth, we have social workers on staff, peer support on staff every day, well, Monday to Friday. We have psychiatrists from White River Junction that pop in a couple of times a month, as well as nurses to provide support at that facility. So Wednesday of last week, this was in Manchester, we were made aware through the VA outreach workers that there was a homeless female veteran living out of her Jeep, and her vehicle ultimately got towed away, and that it was everything in her worldly possessions were there. And they contacted us. We went out, conducted a screening, and within 4 hours from initial contact, she was in transitional housing. And we gave her a little bit of time, and shortly thereafter began service planning.
Mayor?
Yeah.
So you, again, I know that sometimes so you're having them go through the enrollment process and so on, even if they're not necessarily qualified, just so that they can get their name on the list and so on. So if they become, to the point where they become indigent or something, that they can possibly qualify for some type of benefit or care.
Yeah.
So they do go through.
Yeah, we do have an initial screening to verify that they are indeed a veteran.
Okay.
So once that's determined, then we work with the VA and other community partners to figure out what are the benefits that they can get access to.
Amazing how many of them will still carry that DD-214. They may not have much of anything, but
Yeah.
they will have that one form.
They
And
will.
if they don't, it's easy enough to
amazing
get
how
that.
many don't, too.
No,
Yeah,
but it's
yeah.
it's amazing that we can get that form for them. I've worked with veterans I've got a hold of that form, and amazingly enough, and it's not always a DD-214 anymore, I know.
Yeah.
They've changed and so on, but thank you.
Yep.
Thank you for helping.
Okay, Alderman Senate.
Yeah, I just wanted to run one final question by you, just it's a point of curiosity of mine, cycling back to the Cynthia Day program.
Sure.
That is, I mean, like most situations I think that you deal with, I think that has its own unique sort of complexities, dealing with pregnant or, caring mothers who are dealing with substance abuse issues. That program, is that structured so that whenever possible, children are able to stay with their mothers while they're within the program?
Yes.
Good.
Yes.
No,
We do.
it's something dear to me because personal relations that I've had, who've experienced such situations, and the separation and the process of reunification can become even more complex than the issue at hand already is. So
Yeah.
it's really nice to hear that when that's possible, those families can stay together.
Yes. So we also work very closely with DCYF to reunite families. In some cases, well, depending on the situation, the child might not be with the mother unless she seeks treatment and is stable. So we do that from actually quite frequently. And
Just a quick follow-up, if I may. I would assume too, for mothers who are coming to the program who are pregnant, I mean, again, I keep using the word complexity. That's its own wrinkle to the story too. I would assume that you have the contacts with the local hospitals,
Yes.
things like that, for children who are potentially born with their own substance reliance
right.
from in utero. Okay.
Yes, yes. So we work with the hospitals, and we're actually pretty excited about launching the clinic early January, because we're going to be able to provide primary care and other services to both the mom and the children that are in the building.
That's fantastic. Thank you
Yeah.
so much.
Now, these are very impressive programs, but there's also a lot of voucher-based support housing programs too?
Yes.
Okay, just didn't want to miss that, if there's any comments you wanted to make on that too.
We do manage mainstream vouchers, also known as Section 8. And most of those vouchers are provided to individuals living in and around the greater Nashua area.
Alderman Clee.
Thank you. Are you finding that the vouchers are significant enough that they can actually be used? I mean, that was one of the problems that we had with our welfare department, was we'd give the vouchers, but they weren't enough to be accepted.
Yeah, that has been a challenge, not only for the mainstream voucher program, but for the Veterans Affairs Supportive Housing, or VASH, vouchers as well.
Yeah.
Because the cost of renting has gone up quite a bit. It is a challenge.
Right.
We have had some success. As a matter of fact, one of the bodies of work that we're very proud of is that beginning in April 2020, we put forth a concerted effort to identify individuals who are chronically homeless in the greater Nashua area and connect them to housing. And since we've launched that initiative as of the summer of this year, again, beginning in April 2020, we were able to provide housing to nearly 200 individuals who were previously chronically homeless.
May I ask?
Alderman Clee.
I know this, are vouchers stackable? I know it sounds silly, but between the VASH program and our welfare, could you stack vouchers? It's one shot. You can use like a VASH, or you could use the city welfare, but you cannot stack. It's like stacking coupons, huh? No, you can't do that.
I think all the programs would have to really trust each other, because you give someone a VASH voucher, but they're in a place that they're relying on the city of Nashua for.
Right.
The city of Nashua is like, I mean, with respect to Director Bagley, is not in it for the long haul if they don't
Yeah.
have to be. They're just trying to stabilize. So
Yeah.
all of these different programs have different levels of support.
Yeah,
So stacking them's got to be a heck of a risk, or
Yeah.
LOU, I guess.
I know. And,
Um,
and actually, it wouldn't be a healthy, workable type of thing anyways, but, yeah, I know. That's a problem with the voucher programs, is people continue going up with the rents, and these vouchers, they almost become useless after a while. So, thank you.
All right, any final questions or comments? Alderman Kelly, sorry.
Just a comment in general about affordable housing. Affordable was the key piece here. One of the things that came up in the meeting that I had recently was that average wage is between $21 and $25, and $31 is what you can afford housing on right now. So not only do we need to look at housing coming down, but actual people need to be paid enough to afford that. So
Well,
but
I
that was
think part
quite
of
a
that
gap.
is we also have to be very attentive, if we're going to advocate on the issue, to what the terms mean, because affordable housing is a definition regularly used by HUD with their definition underneath it, but it's not colloquially understood to be an affordable amount. Whereas
Fair.
other terms like low income, fixed income, or elderly housing might have different, connotations to them.
And I actually made that point. Affordable housing as a term has a very specific definition, but also in my mind, just housing that is affordable is critical. And the
It'd be nice if we could all agree that the words that we use should mean what they say, but, any other final comments? All right, thank you for coming. We appreciate your time and all your work in the community.
Thank you for having me. Happy holidays.
Nice seeing you.
Mr. Clerk, do we have any communications?
We do not.
Unfinished business?
There is none.
New business resolutions?
We have R24-117, relative to the acceptance of grant funds pursuant to Contract Amendment Number 2 in the amount of $220,000 from the State of New Hampshire Department of Health and Human Services into the Public Health Infrastructure Grant Activity. At this time, I'd like to make a motion to recommend final passage.
Okay, and we have Director Bagley here to walk us through what we're doing.
Yes, thank you. Thank you for having me this evening from our Division of Public Health and Community Services. So this funding that we've received is part of a CDC funding stream that's a pass-through to the state. And the funding was designed for public health infrastructure. Coming out of COVID, what we saw was that we needed to have a functioning public health department and be able to sustain that workforce. So this funding went across the several states, in the country to just build and maintain the public health workforce as it is. And it's basically for workforce capacity, also for training and support of any of the operations that we currently have running in the health department. So this $220,000 is $110,000 for 2 years. And currently, what we're using this funding for is support staffing. We were down one position in our welfare department, and this funding for this fiscal year is being used to support that welfare staff. The goal is to demonstrate the need for that position so that next fiscal year it goes back under the general fund and covered under welfare administration. Because this is not going to be funding that's long-term, it's temporary. And so we're able to do that for right now. And we've been talking about housing, we've been talking about our vouchers and the work that needs to be done to support our unhoused population, and even not just the unhoused population, but those who are in situations where the housing stability is jeopardized. And so the work that is done in our welfare department, there's assessments that are done when people come in to get that assistance. And it was found that we needed to have another staff person on board to do that because of the complexity of the cases that we're now starting to see from individuals that are coming in. I happened to attend a policy forum today that Dartmouth put on, and one of the components of that was housing infrastructure. So all these conversations kind of like flow right in there because we have a national housing crisis. And just from the statistics that we show, here in our state, that huge increase is impacting welfare, it's impacting our other programs that we have in the community with trying to find housing, or at least to support people so that they don't become unhoused. So that's how we're using that money this year. And then next year, we are supposed to have this money going into 2026. There were no promises made now because there's a change in the federal administration, and there will be some, I want to say, tightening up at the federal level. And so, we're hoping that we'll have $220,000 for the 2 years, but we know we'll at least have the $110 for this fiscal year to carry the staff that we're brought on board.
So even as we're trying to tighten up on our level of the city government, there's also the possibility that some of the services that we might have in the past been able to sort of expect federal support for, might have to end up looking at that in the general budget as well?
Not totally. The way that we typically look at some of the grant funding that we receive from the feds as a pass-through is that even when the state receives those dollars, they know that these programs will exist as long as that funding is there. So there's no expectation that things will be pushed onto cities or municipalities. But because we had this position as a city position before, and now we see that we need to have it back, my goal and my hope is that our alderman will be a part of recommending that this also goes back to a city-funded position, because it was a city-funded position before.
Speaking for myself, I know some of these discussions happen before they come to the aldermanic chamber, but if there are scale downs or cutbacks in your department in order to meet the general city's needs, and you feel as a director that those should be considered, then when we interview in committee, you're definitely welcome to bring those up, because I think I missed a cue here. If we downsized at some point, because I've been trying to consistently advocate for more city welfare staff and support.
We did. Yes.
Any other questions, comments?
You answered my question.
Okay, well, best thing we can do right now is make sure we're supporting this. So we have a motion on the floor to recommend final passage. All those in favor say aye.
Aye.
Opposed?
Nay.
All right. Thank you for your time, Director Bagley. Appreciate your contributions both to this and the previous discussion.
Thank you. Thank you for having me this evening.
And we'll
Drive
see you
carefully
tomorrow.
going home. Yes.
Because we have a special joint committee meeting between this and PEDC. So anybody watching, we will probably have a follow-up to some of this.
I'm sorry, what was that?
We have a joint.
I don't believe tomorrow is a joint. I believe it is just PEDC, but
It's not listed as a joint.
no, it's not. And I spoke to Alderman Moran this weekend regarding that, and he said it was determined at this time not to be a joint committee, but he is very enthusiastically inviting all members of the Human Affairs Committee as well as any other interested parties. I certainly will be there.
Okay.
What's the
All right,
topic of
so
discussion?
there will be a committee meeting tomorrow,
okay.
and it will probably be now
Working
labeled
chapter.
something different than we were expecting. So just everybody keep your eyes out. All right.
All right, thank you.
Mr. Clerk, new business ordinances?
There are none.
Table in committee.
There is nothing.
Any general discussion? Seeing none. Public comment.
No public.
There appear to be no members of the public present. Remarks by Alderman. Anyone have remarks they would like to make? I would like to just comment that we did a lot of presentations on the people that are at Delena's house, so it would be silly of me not to mention National Veterans Promise. It's a small organization that is not Harbor Homes, but is supportive of building stronger communities in between veterans and the community. So they've been partnering with a bunch of local businesses like Caribbean Breeze or Jaja Bells, Soul Sisters, downtown to collect decorations. There's a bin right out to the mayor's office, so if anybody has any extra holiday decorations for the rest of this week, we'll be collecting those. We've been bringing them to the veterans over at Delena's house so they can decorate their halls, their rooms, and all that. And then there will be a holiday party where the best decorated hallway will be recognized with gift cards. There'll be gift cards for the veterans who come out to the holiday party. It's just a way of making sure they feel like Nashua welcomes them and they're not just working at a program that happens to be in Nashua. Because again, I think we all agree that they're a major part of our community and we want them to feel welcome and involved. So check out National Veterans Promise. Check out if you see a bin anywhere that you're going downtown and you have extra holiday decorations, feel free to share.
I brought a box.
Alderman Kelly did bring a big box, and we appreciate it. There's a table tree that I'm sure is going to grace a common area. All right, so
Did you have
Can I get a-
remarks?
I was gonna move to adjourn if we were ready. I was
you're
just
ready.
waiting for him. Move to
Alderman
adjourn.
Kelly? All right, all in favor of adjourn, say aye.
Aye.
Opposed? And we are adjourned at 7:42 PM.
I wasn't trying to.